So for those of you who have already clocked it, I've given the answer away to the question I usually pose. I'm Andy Turner from Coventry University, and I'll just set the time for 10 minutes, because for those of my colleagues who have worked with me, know it's going to be a struggle to keep to 10 minutes, but so I'll make sure I time myself. And I've been working at Coventry University for 18 years. I'm a health psychology researcher. And for 18 years, my interest has been in self-management of long-term conditions. Started off as a researcher, a pure evaluator stroke researcher of other people's programs, the Expert Patients program probably being the most popular and one that some of you may have heard of. But in the last few years, 5 to 6 years, we also at Coventry have started to develop a range of our own self-management programs for people with long-term conditions, which we call variously HOPE, if it's the group-based courses, the face-to-face courses, or now eHOPE, as we've kind of given it a bit of a moniker at the minute. But as Chris said, eHOPE, I was thinking it almost sounds like e-by gum hope. So maybe we need to give it a different name. So, and it's the digital theme I'll be talking about today, and trying to get across why I think self-management programs, although they're not therapy, they're not psychological treatments as such, why self-management programs may be helpful for people with long-term conditions, including dementia and cancer, with common mental health problems, anxiety and depression, and some of the mechanisms that we've explored over the years as to why we think they're helpful for people with mental health problems, and why we think that a digital solution will increase the scalability, the reach, but also help people, continue to help people with mental health problems. So the most exciting innovation of the connected health era, and if we went around the room, if we had time, most people would be going, it's apps, it's digital platforms, it's all the wonderful gadgets and gizmos, and of course that's right, and to say we've been funded by the West Midlands HSN to develop a digital course for people with dementia. But underpinning all of our work, and hopefully after 10 minutes we'll have got this across repeatedly so, that our work has always been around putting the patient's needs first. And the peer support, the Expert Patients program was as a self-management course, is delivered by patients. Our programs many of our programs that we've developed are either solely delivered by peers or patients or lay facilitators, or they're co-delivered alongside a health professional. And so what I love about this quote, it absolutely embodies the philosophy of our work. So this is the most exciting innovation. It's the peers talking with each other. And that can happen online, offline, via email, or good old face-to-face groups. So how do we ensure that as we move from face-to-face and develop digital solutions to self-management, that for us, it's how we still keep that peer involvement, that peer support. And just some very brief research context. There was a big randomised controlled trial of self-management in primary care. Found out it didn't particularly work very well. And Anne Kennedy and Rogers, who are doing some fantastic work around self-management, they've come up with these, the new research agenda for self-management, in as much that self-management needs to be embedded in people's real lives, rather than taking the person or the partner, training them and putting them back into their community. It's how to embed self-management in people's lives, how to use the language that they understand, and the tools and the techniques, so cartoons, photos, images, edutainment, to actually reinforce self-management messages and to make them relevant to people's lives. And then also, and I'll hopefully demonstrate with a case study of the strength of weak, particularly online ties. So how can people develop social support very quickly by being on an online platform where the only interaction they've had is via email or discussion forums, and they've just seen a photo of someone else? How can we develop this peer support online? Just very briefly, a lot of our work over the last few years has been developing self-management support solutions for cancer. I'll let you read that. A big problem, cancer survivorship on the increase worldwide. And what's interesting with cancer, if you don't know, up to 40%, and this is the mental health link, that 40% of cancer survivors post 5 years treatment still experience significant psychosocial distress around fear of recurrence. So there's lots of unmet needs for cancer survivors, which we're going some way to provide. We've developed a group-based course, 6-week self-management course, which teaches coping skills and depression management skills, and that's for the person affected by cancer and their partner as well. And we've just recently, we're on our third cohort of an online course for people with self-management. And I'll briefly describe some of that in a moment. There are over 2,000 cancer survivors have attended predominantly the group-based self-management programs in the community. And as I said, we're now on our third pilot course with the online group, and so I think it's nearly 70 have nearly gone through. And then we've trained over 300 cancer survivors and cancer health professionals to deliver the course. This programme now has been licensed by Macmillan Cancer Support and is being run across the UK. Our other piece of exciting work, and work that will be a major focus for us over the next few years, is in dementia. We've been working with Nikki Bradbury there, if you want to kind of wave, that is the clinical lead on this programme. And we've again developed a group-based version of the HOPE programme for people with early stage dementia and their partners. And we've run, or Nikki's team has run, over 30 programmes in the community. And as part of some previous funding from the health education, the hike, I can't remember what it was called now, health education cluster, yeah. They funded some early work around the group development, the group programme face-to-face, and also we tested one Skype-based course in that project, and now we're, as Chris said, we've been fortunate to get AHSN funding to develop and run more courses. And I'll briefly describe in a moment what the differences are between the group-based and what the similarities are that will be found in the group-based course and the online courses. And that, as I said, is now part of the service being provided by Birmingham Solihull Mental Health Foundation Trust. So for me as a researcher, for 18 years, we get involved in lots of pilot work that kind of never sees the light of day. They're fantastic little bits of work. So for Macmillan to license the cancer course and run it nationwide, and for Birmingham to adopt the dementia course, it's just so rewarding for me. And the next stage is, as we move over to the digital offering for people with dementia, is that it can be scaled up and offered across the UK. How does it work? I heard a couple of people mention about public health. So these are programs for people with long-term conditions. We also think, because of the underlying theory, which is a positive psychological theory, that it can also be used at the prevention end as well of people, whether they've got a long-term condition or not. We think there's multiple uses for these programs. And we focus, and I'll just focus on this now, what do we mean by positive psychology? Is that we use positive psychological processes and techniques to improve positive mental well-being. That's the focus. It's not a treatment for people with depression as such. But what happens is as you focus on people's positive mental well-being, their anxiety and depression improves as well. So by focusing on a wellness model, it taps into the public health agenda as well. And the feedback from facilitators and people with early stage dementia and people with cancer is they value the different conversations that you have on these courses in terms of you have got some innate strengths and resources, let's focus on them and let's build on them. And our research has shown that we do see improvements in anxiety and depression. And we think it's down to, or we suggest that it's down to what Irving Yalom, some of you may know his work, is described as a group curative factor. And he suggests that, so he's written a handbook about psychotherapy, he says the same group factors will occur, and in his latest edition he makes reference to self-management programs. The group factors, the group curative factors, will also occur in self-management programs. And this is the most popular one and most common one that we see, that when you ask participants what they found useful, they say, there are 800,000 people with dementia, but I don't know any of those, so there's only one, and that's me. And so all the thoughts and feelings and concerns or anxieties become magnified because they think it's only them that experience that. Once they come on a course, whether it's a group-based or an online one, and then they share experiences, that can be anxiety reducing just in and of itself, just knowing that other people feel the same. And I'll show you a case study of that in a minute. So what's in eHOPE? The cancer course, 2 minutes. The cancer course is what we call asynchronous, is that 25 people with cancer across the UK log on to the 6 weekly sessions. They choose when to log on, and so they don't come together at any stage. They post in a forum and then people respond asynchronously. And so what's in there? Self-monitoring tools. People get to measure their positive mental well-being. There are quizzes, there are worksheets, there are videos, and there are discussion forums. And there are interactive, what we call gratitude and goal-setting walls as well. And what we've seen on the cancer course is that people are using to go through the materials, the actual courseware materials, would probably take about 2 hours maximum. But people are spending 4 or 5 hours on the site because of the social networking facilities. That people are using the discussion forums, they're emailing each other, and they're using the interactive gratitude wall. So people post their goals, post their things that they're grateful for, and then people log on and comment, and so it's that social networking, which we're pleased because we're trying to get across this peer support, peer involvement. And then I'll just briefly talk about why, again, we think that we're seeing how it works for cancer survivors and why we're confident that it will work for people with dementia as well. So this is it's a male cancer survivor in his 50s. This is a course that's going on at the minute. I just quickly analysed this data last night. So in the pre-course questionnaire, the PHQ-9, he scored 15, which is showing that he's moderately severely depressed. His anxiety score he's showing moderate anxiety. And then the comment in the bottom of his questionnaire, he says, I feel guilty that my cancer is not going away and the pain that I'm causing my family. And then this is what we're seeing as part of the test. We asked them to describe their emotions. So in week 1, he was interested, he's guilty, and that kind of fits in nicely with what he's saying there. He feels guilty and he's scared. That's in week 1. By week 2, he's interested, obviously. You could say, well, that's obvious because he's joined the course. But he's guilty again in week 2 and enthusiastic. But by week 3, the guilt's gone. He hasn't selected that as an emotion. And he said he's interested, enthusiastic, and active. And then when you look at his goal, because what's an important part of this course is not just the discussion forums and the peer support, is the behavioural contracting, the smart goal setting that people make a behavioural goal and then feedback the following week. So his goal in week 2 was to walk the dog, and this is his feedback. He was successful in his goal, and he's enjoyed it so much that he's now continuing with that and getting up early in the morning. So it that ties in nicely with the fact that the guilt's gone, so he's getting something from the course. He's now starting to feel a bit more positive, and he's describing himself as more active. On the dementia course, the Skype-based course we ran, That was a course that ran for 6 weeks. People came together at the same time. It was the person living with dementia and their carer. And the feedback from there, again, was extremely positive, that they enjoyed coming together and seeing each other and being with each other on a course. But the feedback was that they felt as if something was missing in between each week, that they wanted, which is what we're testing now in the cancer course, access to the materials. They want to go back and look at the materials. And that's what we're going to be planning to do with the AHSM project. And then just very 1 minute to get there. So this is the strength of weak ties. That's the person with dementia who went on Skype-based one. The best part for me is to know I'm not on my own with the dementia. So if you think back to the Irvin Yalom's curative factor, why people feel less anxious, less depressed, more reassured, knowing that people on the group experience the same issues. And then this one on a previous cancer course, this was a lady who got a gynecological cancer, and as you can see there, she's her 2 male adult sons and husband don't want to talk about it. She's 3 years post-treatment and they don't want to talk about it. So 3 years post-treatment, she's still got these issues that she's never been able to talk about. So what the discussion forums allow us to do, and what the online course allows people to do, is to share them with other people going through similar experience. So you can see there, has anyone else had similar thoughts? And there was a whole range of posts and reassurance and similar experiences that were posted. We need to be mindful of not being completely seduced by technology. We think there's fantastic opportunities, but and from my own experience, I had to go to a conference one day, and my daughter took my sat-nav, and it was kind of, I had that initial, I'm not going to be able to get there now. So, and of course, what I did, I used the map, drove somewhere near to the venue, stopped, asked somebody which way to go, and so we've got to be mindful of the fact that for us particularly, we use the technology to provide support and engagement and peer support. We see the technology as an end, as a means to an end. Next steps, that's what we co-delivered asynchronous dementia course, because what we haven't managed to do yet on the dementia course is get either the person living with early stage dementia or their partner to co-deliver the course. We think we could do this online. And then we could be training HOPE Digital Angels. Obviously, I've stolen that from Barclays. Obviously, no trademark. We could be training peers to support other people to use the technology. And then Nikki, she might say something in the discussion around, can we be developing for people with mild cognitive impairment digital monitoring tools as well. So thank you very much.
Thank you so much.